Okay, so some of the responsibilities of investigator are records and reports. Records and reports. So when we are speaking about records and reports, there are list of documents which has to be stored or archived by investigator. So one of those documents are source documents. One of those documents are source documents. So investigator is responsible for source documents archiving or storing the source document. So whatever source documents we are going to get at the trial specific level, we have to store as accurate as possible. So this is one of the responsibility, and it should be attributable, legible, contemporaneous, original, and accurate. So we always say that all-COA. So it all stands for, A stands for attributable, L stands for legible, C stands for contemporaneous, O stands for original, A stands for accurate. So whenever we think about what is the how the source documents have to be archived, then it is as per all-COA. So it should be accurate, original, and contemporaneous documents has to be stored for the source document. So this is the point number one. We need to make sure that the source documents are being archived. An investigator should ensure, always should ensure, the documents are accurate, complete, and legible. Accurate, complete, and legible. So if you are using paper studies, then it should be legible and accurate and complete, both in paper and EDC. You have to make sure that the data is accurate for case report forms. So, or in other words, CRF. The CRF documents should be as much as accurate possible, and it should be complete, and also it should be legible, which is being reported to the sponsor on the case report form. Now, the next one is investigator should transcribe. Investigator should transcribe the data from source documents to CRFs. Now, whose responsibility is transcribing of source documents to case report form is investigator responsibility, or it is also called as source data conversion or transcribing the source data, original records. We will transcribe this data into the case report form. And the responsibility whether the source documents have been clearly entered or is being transcribed correctly into case report form is the responsibility of monitor. But to enter, it's a responsibility of investigator to transcribe into case report form from the source document. And one of the most important responsibility is investigator should make sure any changes to CRF is dated, signed, and provided reason. So any changes which is being made by the investigator should have the date and signed and explain the reason, what is the change we have made and why the obscuring or why the changing of original data is being done. And we should never ever delete the data, and every time we need to have reconstruction of data. We should not obscure the data when you are using paper studies. In case of any paper studies, the data might be obscured, but it is not accepted to obscure the data or to strike out the data completely. So data should never be deleted, but it can be updated or it can be changed to the case report form by putting this dated, signed, and with provided reason. Now, the next one, investigator should maintain should maintain all list of essential documents as archived. So now all the documents which are being used, essential documents, let it be protocol, case report form, ICF, completed ICF, source documents, IEBs, and drug accountability form, monitoring report, whatever investigator is handling, it has to be archived at the site location by the investigator. So the document should not be destructed unless and until it is being accepted by your sponsor. And all the essential documents should be archived for a period of 2 years after completion of trials. So, and essential documents should not be destructed. It should be archived for the period of 2 years after the completion of clinical trial. So the 2 years is the time when the trial completed or getting the approval of the drug. Next one, the financial agreement. All the financial agreements should be recorded accurately by the investigator. So whatever the plan is there for clinical trial agreement or financial agreement, what would be the compensation or money to be paid by the sponsor to the investigator should be clearly described in your financial agreement or clinical trial agreement. Now, whenever the monitor or auditor or inspector ask for document or ask for permission to examine the documents, investigator should provide the documents. Investigator should provide the documents. So now these are the records and reports. I'll repeat it. Investigator should maintain all the adequate and accurate documents which has attributable, legible, contemporaneous, original, and accurate and complete documents, all COVA. And should ensure all the documents which are entered into the case report form are accurate, complete, and legible. Investigator responsibility is to enter into case report form which is accurate, legible, and complete. Investigator is responsible for transcribing the source document to the case report form. Whenever investigator is making any changes to case report form, he should approve, he should make changes with putting a date and sign and providing a reason. So these are the changes which has to be made, and data should not be obscured or deleted. Reconstruction should always be made available. Investigator should maintain essential document or should archive the essential document at the site location. All the essential documents should be archived for the period of 2 years after completion of trial or after you get approval of the documents. Now, financial agreements should be recorded by investigator, and monitor, auditor, or inspector, if they ask for permission to examine, investigator should provide the documents for reviewing of the essential documents. So this is about the records and reports. Coming back to next section, which is progress reports. So progress reports. Now, progress reports, investigator is responsible to give a summary of clinical trials to IRB and IEC and for at least yearly once. So investigator is responsible to submit the status of clinical trial, to IRB or IEC at least once in a year. So at least once in a year, they have to provide a report to IRB, IEC. Investigator should also promptly provide a written reports to sponsor. Investigator should also provide a written report to sponsor where applicable. There is a significant affecting of clinical trial or increase in the risk of subject. Whenever there is an increase risk of subjects or affecting human lives. So this is the reports, the progress reports which will be provided by investigator to IRB, IEC as well as to the sponsor. So this is about progress reports. Now coming back to one of the most important thing, which is called as safety reporting. Whenever there is an adverse event, which is serious, unexpected, related, the investigator should report immediately within 24 hours. Within 24 hours to sponsor. And the same way, all serious, unexpected and related adverse events, investigator should report to IRB, IEC within 7 calendar days. So whenever the serious adverse reactions happen, serious adverse event happens, should be reported to sponsor. But if it is already mentioned in the protocol that this serious adverse event does not need to be reported for immediate reporting, then not needed. But most of cases, all serious adverse events should be reported immediately within 24 hours to the sponsor. And now any serious adverse events which happens at the site, investigator should report to IRB, IEC within 7 calendar days. And adverse events which are from laboratory abnormalities or symptoms, which can be specifically given in protocol for special circumstances for reporting, then you need to report immediately. So the word which we have is AESI, adverse event of special interest. Now, this adverse events are called as any adverse event which is having more problematic with that particular drug will be clearly mentioned in protocol. So mentioned in protocol should be immediately reported. To the sponsor. As given into your protocol. The investigator should provide a written report. If any changes or if you have additional requested information, then you need to provide those information to the sponsor and IRB. So say for example, subject has got a serious adverse event, which is death. In case of death, then investigator should provide supplementary records or supplemental records, which are autopsy reports, which is post-mortem report if in case of patient is died and you need to know the reason for the death of the patient, then investigator should sufficiently provide the information to the sponsor, and investigator should submit this all documents along with the serious adverse event. In case of hospitalization, investigator should provide the summary of hospital record or the summary of discharge. Discharge summary should be provided by the investigator to the sponsor. So this is about safety reporting. All the serious adverse event which are serious, unexpected and related should be reported from investigator immediately within 24 hours to the sponsor. All the serious adverse events should be reported to IRB IEC within 7 calendar days. Any adverse event which has a more problems with particular drug, AESI, adverse event of special interest, mentioned in protocol should be immediately reported to the sponsor. And if there is a death cases, then investigator should provide supplemental records such as autopsy report should be provided. Next section is premature termination or suspension. Premature termination or suspension of trial. Investigator has responsibility to terminate or suspend the clinical trial. An investigator should clearly inform to the IRB IEC with explanation of termination or suspension. So whenever investigator has ability to terminate a clinical trial, but if he terminates the clinical trial, a written explanation should be given to the IRB and IEC. So IRB IEC should be informed with a detailed written explanation of termination or suspension of clinical trial. And in case if sponsor wants to terminate, sponsor terminates the clinical trial, then sponsor should provide the detailed written report to IRB IEC and sponsor. So both people, they have to provide the report. And now last one, if IRB IEC terminates clinical trial, if IRB IEC suspends or terminates the clinical trial, then in that case, the investigator should inform the institution or investigator should inform to the sponsor. IRB will inform the investigator and investigator should inform to sponsor. So this is about premature termination. If investigator terminates, he should go and give written explanation. If sponsor terminates, he gives the written instructions or written detailed report to IRB sponsor. If IRB terminates, then he goes and reports to investigator. Investigator will report to sponsor. And next section is final report by the investigator. So there is a final report which has to be given by the investigator. So upon completion of trial, so once the trial is upon completion of trial, investigator should provide final report to IRB, IEC, sponsor, and regulatory bodies if applicable. So upon completion of clinical trial, investigator should provide a final report to IRB-IEC and also to the regulatory bodies if it is required or if it is applicable. So these are the responsibilities of investigator. The first one, records and reports. I spoke about the source documents, CRF, transcribing, essential documents, and all those details. I spoke about the progress reports. Investigator has to submit it to IRB-IEC and as well as to the sponsor. Safety reporting, the timeline which has to be reported for the serious adverse events to the sponsor, to the IRB-IEC, and any AESIs and supplemental records I spoke. And premature termination of clinical trial or suspension of clinical trial. I spoke about investigator should terminate the, or investigator in case he terminates the clinical trial should give a written explanation or detailed explanation to IRB. If sponsor terminates, sponsor will provide to IRB and as well as to the investigator. Sponsor will provide to IRB and investigator. If IRB terminates the clinical trial, IRB will give information to investigator, investigator to the sponsor. And final report, upon completion of clinical trial, investigator should provide a final report to IRB-IEC about the status of clinical trial and outcome of the clinical trial to the sponsor as well as to the regulatory body if applicable.